We are a go. Hello, everybody. Welcome to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, here with my dear friend Tark Ibrahim from Ibrahim Strategies Group. And you are watching Fertility Fact or Fiction, our live show where we bring you the best of everything related to fertility that's available and share with you the latest and greatest information, as well as try and answer cases, questions, concerns, quandaries, and everything else that we can, and have a generally pretty good time too most of the time. This show has gone global. We've got people from all over the world watching, so thank you to all of you who tune in every week. And we're finally back together. It's been like a month since we were together, right?
Long overdue.
Yeah, I know. I missed you. It wasn't the same.
Wasn't the same.
It wasn't the same. Yeah.
My week was suffering. There was a moment where I was contemplating suicide. I said, I'll see him next week.
That's not funny. You can't joke about stuff like that.
For a moment.
Just for a moment. Yeah, I missed you too, buddy. So
it wasn't my wife. It wasn't my kids. It was
just me. Yeah,
that's right.
Yeah. No, I missed you too. So it's good to have you back. We're finally back together in the same room. And so exciting stuff. I scoured the internet for an interesting paper. There's literally nothing out there that's new. I can tell you here at VRC, we're going to be trying some new techniques with sperm to see if we can get the sperm to be better. So that's kind of interesting. I'm excited about that. And we're running it as a trial. We're very close to starting our research project on whether a certain drug will relax the uterus more at the time of embryo implantation. So we're going to run a randomized controlled trial on that. I'm excited about that because it's never been done before. So we will be the first. And we are very close to opening our St. Catherine's Clinic. It'll be open in 2 weeks. So for those of you that are over that way, don't hesitate. Get your doctors to refer you to Victory Reproductive Care St. Catherine's. We've got a great doctor who's going to be working there, and we'll have all the equipment up and running shortly as well. So very, very excited about that opportunity. I've been wanting to bring some care and attention to that region for quite some time. Excited to be doing it now. And we are also going to be opening up another clinic not too far away. And that'll be next on the agenda. And then we're going to probably look at locations in and around Toronto, very possibly around where I used to work. So possible options in and around that area as well. So excited for all of the growth and all the people that we're helping. Thank you to those of you who wished me well for my back. I have to say, I'm not a huge believer in alternative medicine stuff for myself. I do believe in it for our patients because I've seen it work, but I never really tried a whole bunch of it. I finally gave in, and there's a lady doing traditional Chinese medicine PhD who wanted to follow me around and shadow me, and she finally convinced me to let her do acupuncture on me, and it was the only thing that cured me after all this time. So Natasha, God bless you. You are my savior, and you literally got most of my back and upper leg out of spasm. I'm still on a little bit of spasm in my calf, but that's the only part of me that still hurts. So hopefully I can work that out soon. So great to have you all here. We don't have a topic for tonight. I'm happy to discuss a topic. I will be presenting extensively on everything endometriosis at the Canadian Fertility Show on Saturday in Toronto. So if you haven't bought your tickets already, please come down and check it out, and you'll get to meet us in person, and you will get to ask any questions you want there as well. We're doing a live Fertility Fact Fiction. In fact, I have to talk to you about that because we could set this up and broadcast it while we're doing it if they say yes at the show. So I'll ask Marissa, who kind of runs it, and see what she says. Yeah. So with no further ado, I'm open for questions.
You could also mention the doctor talks.
Oh, yes. Yeah. Sorry. That's a good one. So two other things to mention to everybody now that you've all logged on. Number one is that we have this little green badge here that I'm wearing. This is from the Fertility Friends Foundation. Fertility Friends Foundation is this amazing organization started by a very dear friend of mine who's also a fertility specialist, and his wife, who's also a fertility specialist. And they essentially started this grant foundation where you can apply to get grants that will help you with your IVF. And they're now changing it to also see if clinics will offer free cycles of IVF rather than doing it based on a grant. So we are part of that. I'm very proud to be part of Fertility Friends Foundation. They have raised tons of money and helped many, many people go through with their IVF. So you can find them online, Fertility Friends Foundation. And the people that run it are exceptionally good, kind people. It's all very honest and transparent. And the fertility clinics and the fertility specialists who started it have nothing to do with like who's chosen. There's no interference. There's no sort of special treatment given to this person or that person. So brilliant foundation. If you haven't checked it out, please do. As well, I was part of a summit on fertility talks with various people contributing from naturopathic views and from scientific views and so on. So Tark's going to put up the QR code. Please check the QR code and scan that and check out the talks that are there. They are pretty valuable. You can find all kinds of different help and opinions and viewpoints on improving your fertility health, and that's kicking off today. So check that out and see what you think about that whole process.
Questions? You ready?
I am ready. Yeah.
Hello, Dr. V and Dr. T.
There you go. Automatically, you're picking that one.
I picked that one without any hesitation, just so everybody knows. I gravitate to those.
Yeah.
That one didn't even have a question. It's just salutations, but I read it. Yeah. Hi, Dr. V and T. This one got lucky. Does Antagonist start date impact the outcome of stimulation start on day 5 versus day 6? When do you start Antagonist, and do you look at follicle size and day of stimulation or LH?
You look at everything. So you can look at follicle size. Excuse me. You can look at E2 level. You can look at the LH level. Certainly, if the LH level is going up, you have to jump on board and get the Antagonist on, or else you'll miss it, and you could have a surge and ovulate. But otherwise, we do it based on follicle sizes, and sometimes I'll use my discretion with the estradiol dose as well to see how high the estradiol is, because if the estradiol level is getting quite high, again, you have to start it, because remember, your brain doesn't know how big the follicles are. Your brain recognizes how big the follicles are by the amount of estrogen being produced. And over a certain threshold, it's going to think that you've got a dominant follicle, and it's going to send the signal, which is the LH signal, to surge and therefore start the cascade pathway that leads to ovulation. So you have to catch that before it gets to that stage, or else you're going to allow escape ovulation. Then it doesn't mess up the cycle completely, but it's not good. You'll probably lose one or more eggs in that process.
Hi, Dr. VT. I have an intramural fibroid, 0.7 centimeters, right side of mid-body uterus. What would be the right FET protocol to avoid a miscarriage?
If it's intramural and it's 0.7 centimeters, it has no impact on your embryo transfer at all. So unless it's indenting the cavity or it's more than 4 centimeters, you don't have to worry about an intramural fibroid. They're not going to have any consequence at all. And that's been shown in multiple studies as well as meta-analyses. So protocol, I mean, lowest miscarriage risk is associated with doing a letrozole protocol, which is why we use it. So that's what we would recommend. The letrozole protocol would give you the best chance for the lowest chance of miscarriage. Double progesterone, the rest of it's vitamins, supplements, things like that. Making sure they measure your levels, making sure your lining's not too thick, too thin. All of those are important. And then your own health, weight, smoking, drug use, marijuana, stress, all of that stuff.
I'm on week 6 of monthly Lupron and taking 5 milligrams letrozole also.
Yep.
Suddenly started spotting. Blood tests for E2 and LH are very low, but progesterone is 34 nanomoles. Why is it high? Am I ovulating?
I'd get a preg test, get a beta, and make sure you're not pregnant and don't know it. And then you may have had a breakthrough ovulation, and that's why your progesterone level's high, but get checked out for sure.
Hi, Dr. V&T. Can you help me understand what happened to a friend of mine? She went into labor at 29 weeks, but her bowels failed as well. Baby unfortunately didn't make it, and she lost some organs in the process. Turns out because the bowels failed, the baby was expelled. I'm trying to wrap my head around what happened.
I would need way more detail to understand something like that. My heart goes out to your friend and to you, and obviously to that poor baby. I can't give you an explanation. I would need way more information to answer that. I don't really know what a bowel failure means unless she had an ileus or her bowel stopped working or something. So I'm so sorry, that's tragic, but that whole thing sounds very bizarre. First of all, people's bowels don't like quote unquote fail typically. And second of all, babies at 29 weeks usually do okay. So I would need more info about what happened.
Can the ultrasound detect a placenta abruption?
A placental abruption has to be very large to be detected on ultrasound. So yes, you can see them, but they've got to be big. And by the time it's big enough to be seen behind a placenta on ultrasound, your baby's probably to some extent compromised. So generally speaking, you won't always see a placental abruption. It's more of a clinical diagnosis than it is one related to ultrasonographic findings.
Do you have an opinion about subcutaneous progesterone?
Yeah, it's called Lubion. I think it's available in Europe. Supposedly, in head-to-head comparisons, it's just as good as the intramuscular progesterone. So it should be an okay product. I got an opinion, I think, about most things.
Yeah.
We're pretty opinionated here for sure.
We have opinion on
Yeah,
a regular
in
basis.
a gentle way, but we are.
Do you have, in your experience, does a positive ANA typically correlate with any specific abnormal fertility immune tests?
Oh, that's a great question. Not that I'm aware of. I'm going to be seeing the guys from Fertility on the weekend. I will ask them. Good question. Not that I'm aware of. If anything, I'd probably be more involved with the thrombophilia screening, not their immune testing.
Hello, Dr. V and Dr. T.
Yep.
Yeah, that's it.
Hello.
Hello, indeed. Question. What to treat Staphylococcus chronic endometritis with? I confirmed with Fertility, was treated with amoxicillin and clav, and it is still there, I guess.
Yeah, so you can use moxifloxacin is what we use next if the clavulin doesn't work. Yeah.
For an egg retrieval with endo, do you ever use letrozole to keep estrogen down? Do you make less eggs?
So we used to use letrozole for our egg retrievals, endo patients, PCOS patients, and the poor responders, because there was evidence we actually reviewed on the show, which showed that that was beneficial. We stopped doing it because we started getting a lot of immature eggs, and the egg quality was going down, and our results suffered. Later, I started seeing articles coming out saying that it was detrimental and that you shouldn't do it. And so we kind of stopped doing it as a result of all that. So I've stopped doing it. I know my colleagues in Toronto area are still using it and they like it. I haven't gone back to it yet. I might try it again first in our donor population and just see what kind of egg quality we get from that. But generally speaking, I shied away from it just because we weren't happy with the results we were getting.
Studies have shown high levels of vitamin B12 can cause autism.
Yes.
But what is considered too much? My prenatal had 1 milligrams of vitamin B12 and recommended dose is 2 mcg.
So the study that showed that you had to have 17 times the upper limit of normal. So you can't get that unless you're taking a toxic level. So I wouldn't worry about it too much.
Do you know of any scientific research about inositol to help with endometriosis and egg quality?
We don't use inositol for endo or egg quality. We use NAC, curcumin, resveratrol, ALA, and coenzyme Q10. I'm not aware of any info on inositol and egg quality, so that I couldn't answer. Yeah.
Can we take immune meds with Lupron like Humira and lit therapy? And what is the normal and safe range for 50 to 1 and 25 to 1 NK cell panel? Can lit address high NK cells?
Lit can address high NK cells. You cannot take Humira or Tacro while you're doing the lit, but you can do it after you've done the lit. And what was the other product? I think that was it, right?
That was it,
yeah. Yeah.
Is there any immune medicine which can work for both high NK cells and high cytokines?
Steroids will help a little bit, but that's the main one that will tackle both.
Here's one.
Okay.
32-year-old.
There's a lot of immune questions out there.
This is something.
Yeah.
32 years old, stage 4 endo.
Okay.
First, all natural FETs failed.
Okay.
Now RE suggests HRT FET with estrase plus PIO plus vaginal progesterone. Thoughts? Is this better or worse than trying a modified natural FET with letrozole?
So I don't tell people what to do, so I'm always cautious about this, but I'll tell you that endometriosis is an estrogen-fed disease. The more estrogen you have, the worse off your endometriosis is. The worse your endo is, the more inflammation you have. The more inflammation you have, we know for sure that it negatively impacts embryo implantation. So my question would be, why would you stimulate the one thing you don't want to stimulate, which is the endometriosis? It just doesn't make any kind of logical sense whatsoever at all. Can you do it? Yes. Should you do it? No, that doesn't make sense to me. I would say letrozole is much, much better. Now, you do need both vaginal and injectable progesterone. We've reviewed that on the show. That's clear. And we've also reviewed the fact that patients with endo are progesterone resistant, so they actually need higher dosages of Prog to get the equivalent effect. So those are things you can definitely look at. We also use supplements. We pre-treat with Lupron and letrozole, and we use an immune protocol that includes rapamycin, because that also has been shown, including on our show through a study that we demonstrated, that it improves your outcomes. So we use steroids, we use intralipids, we use tacrolimus. Like, there's all sorts of ways to make it better with your endo, but I personally would not use an estrogen-based protocol if I could avoid it. Now, do some people need estrogen? Yes, and that's fine, but you want to use the least amount possible. Don't take a lot of estrogen, for sure.
Just want to say, I really appreciate the way you practice medicine.
Oh, thank
These videos have given me hope that there can be a better way to move through fertility treatments. Thank you for that.
Oh, that's awesome. Thank you. I appreciate you watching. That's really nice. We love doing the show because we love helping people. So week after week, that's what we're here for.
Absolutely.
Okay, admittedly, we do like to eat together and laugh a lot.
No harm. No harm in laughing.
And we do laugh a lot.
Yeah.
Tark is probably one of the world's best storytellers, so I love listening to his stories.
Do you know of any scientific research about inositol to help with endometriosis and egg quality?
She asked.
She asked that?
Yeah.
Okay. Hi, Dr. V and Dr. T.
Oh, there you go.
There
you
we
got
go.
it. Yeah.
It's a good day today.
It's a good day today.
What can you do in the lab for under 1% sperm morphology? DNA fragmentation is excellent. Motility, concentration, acceptable.
Well, I mean, you would do ICSI, right? You would individually select the sperm that are normal. That's easy. There's piezoelectric ICSI, so that's supposedly beneficial now as well, although the early studies said it wasn't that helpful, but now they're saying it may be. We have a special column that we are using to select out the more mature sperm, and then we're trying some other stuff as well. So there's lots of different ways you can do it, but the number one thing would be just pick the mature sperm. Now, the other thing the normal sperm. With ICSI, the other thing you should do is spend time improving the sperm. So watch our video on YouTube in the men's section. It's the first one on the top 4 ways to improve men's sperm. But it's super simple. It's don't smoke, don't drink, don't use drugs, ejaculate frequently, take your fertility vitamins, and make sure that you are not heating the testicles or exposing them to electromagnetic radiation. So don't put your cell phone in your pocket. Don't put your laptop on your lap. Stay out of hot tubs, jacuzzis, saunas, hot tubs, that kind of thing. Sit on frozen peas for 20 minutes a day. That helps a lot.
Does VRC have IVIG? Do you work with CNY? They offer it. I know it's difficult to get in Canada.
It's not difficult to get in Canada. It's just super expensive. I do not work with CNY. CNY and I have kind of very opposite approaches to things. They have a massive cookie cutter program helping gajillions of people at a very low cost. And I have a non-cookie cutter program that helps a lot of people at a not as cheap as CNY price, but much cheaper than anything else you can get in the US cost.
What would you want progesterone and estrogen day prior to FET?
In American units, without endo, between 10 and 30. In Canadian units, between 40 and 100. With endo, higher.
Hi, Dr. V and T.
Are you doing TikTok questions as well? Yeah. Okay. All right.
I've convinced my doctor to switch from Orilissa to Lupron, but he still doesn't see why I would also need letrozole. Can you speak to what the benefits are of doing both?
So there's studies demonstrating that Lupron alone is useless prior to FET. So, but there's 2 studies now that show that Lupron plus letrozole prior to FET is beneficial. So I don't really need to speak to it. We've reviewed it on the show. Just tell them to watch the videos and they'll catch it.
Tell them to learn from Dr. Victory.
No, just not from me. Not from me. Just from the science. The science is there. The studies are there. So check those out and you'll see it. It's pretty clear.
If you have APS and MTHFR
Yeah.
and are taking aspirin plus heparin,
Yeah.
do these conditions make it harder to conceive?
I think they do make it harder, but the aspirin and heparin should almost normalize you.
I'm in the area wondering if you work with known donated embryos.
Yeah, sure. No problem at all.
Is estrus priming common practice for IVF retrieval cycles, and can it delay periods?
It shouldn't delay your period at all. Is it common practice? Yes. Do I do it? No. There's a randomized controlled trial we reviewed on the show a while back that demonstrated no benefit and possible harm. So we only do it when we cannot get people to line up their cycle. So I do it like maybe once or twice a year, but it's pretty rare. Yeah.
Are there any out-of-pocket advanced ultrasounds in Ontario/Michigan that can detect cord structures?
Strictures. You can pay for a private ultrasound anywhere. Are there any that can detect cord strictures? No, because depending on where the baby's lying, it's impossible to see all of the cord. So no one can do that. Maybe with an MRI. I don't know.
If you're opening multiple clinics, where are you going to be?
Right here in this chair. So I go back and forth to Sarnia. And I manage this clinic, but I've been forbidden from going to the other ones. So the other ones will be run by other doctors.
I have adenomyosis since starting the meds for IVF. I'm having a 8-centimeter fibroid. Do you consider a surgery on removing it?
I'm not sure I understood that, but an 8-centimeter fibroid, in my opinion, based on the scientific studies, should definitely be removed, because the studies support that if it's a fibroid bigger than 4 centimeters and it's in the wall of the uterus, it does have a negative impact on your outcome. There's a study by Elizabeth Pritts, Pritts, and it's a meta-analysis of all the previous fibroid studies on infertility. And she very clearly showed that once it's over 4 centimeters, you need to remove it for improved outcomes.
Will you have a clinic in Toronto?
Yeah, that's the next project. I will probably be opening up a clinic in Toronto, hopefully by the end of the year, but we'll see. And I need a doctor to do it, so that's a problem, but it's definitely a thought, and I know exactly where I want to go. I'm working on it. That's all I'll say.
What if I do it, but when I get stuck, I ask you for help? Yeah. You know,
we'd both go to jail. That's
yeah.
what would happen
What if
there.
the patient signs a form like, I know it's Dr. T. It's like holistic until we need your help. You know what I mean?
I'd like a show of hands or love signs or whatever for how many of you would go see Dr. T for his medical expertise.
Yeah, I'm telling you. When I get stuck, I give it back to you. It's like a holistic approach.
Tarek knows my history in Toronto and what I went through when there, and he knows that there was one particular location I would love to open up a clinic in. So we may end up going back there. It's a very heavily Persian populated area. I am Persian, so it makes it easier for that population to access care because I speak the language. So we'll see. I may go back to that neighborhood and open up a clinic.
Hands are going up, just so we're clear. just so we're clear, people are. It's not such a horrible idea.
That's so funny. That's so funny.
I'm not. And when I get stuck, I go to you. Like it's not like I'm winging it the whole way.
Well, thanks for clarifying that you would go.
Yeah, of course. Who else can I go to?
I would love to see how many people. We should just do it. This
is an experiment.
We should have Tark's clinic one day. Okay, we'll just set it up as an experiment. And see how many people. You know what? I'm going to do it. So in an upcoming couple of weeks, Tark will have Tark's fertility clinic. It'll be free. We'll televise it, and I will sit there and ask the questions, and we will see how he answers, and see how far we get.
I think I'd do great. I would be dying.
I don't even think I'll be able to read. I'll be dying listening to you answer.
So, the challenge is just to write the scripts quickly enough that no one can actually read it, and then I've mastered it.
Well, you can't do that anymore. It's all digital
it's digital.
now.
Oh,
yeah, it's all you're
no,
screwed.
I'm going old school.
You're going old school.
Yeah, what did this say?
Handwritten stuff. Eh?
He's going to know what I said. He must know what he's doing.
That would be awesome. I think we should do it. It would be so funny to see how many people come.
He said he would call you when he got stuck. I'm telling you, man. That's the only thing.
That's too funny.
I would never take full responsibility without double checking.
Never. Yeah. I think we do it. Tarik's free fertility clinic.
A lot of hearts. Just like,
yeah.
I can't lose much. Let's do Tarik's clinic.
Yeah. That is just pure brilliance. I love it.
Yeah. Not bad, eh? Yeah. They like it. The people are enjoying themselves.
We're going to do it.
Yeah, it's good. I think it's good. People will have fun with that.
Oh.
We need a tea story time. I just gave it. I think that's...
Oh, your stories, you are the best. Even Wendy says you are the best.
Eh?
Oh, yeah. You are the best storyteller. They're so funny.
It'll be part of my my rapport with the patients. Everyone walks in to get a free story. Part of the treatment.
Dark story time. That would be good.
All right. Back to fertility.
Yeah.
Do it. Dr. T in the hot seat. People are...
They're really hanging on this, eh?
I go see Dr.
You want to switch now?
No. I'm not in my scrubs. That's the problem.
All right, no problem. I'll get you some scrubs.
See, I if anything, I think I'd leave happier and with pain from laughter. Overall, it's got a good Zen thing going on here.
It probably would make people laugh pretty hard. That's good. We should think about that. That would be really funny.
Oh, man.
I like it.
Okay. Let's focus here. We got patients that need our help here.
All right.
Okay. Good evening, Dr. Victory and
That was
Dr.
funny.
T.
Yeah.
You know, they just line me up for these things, you know. Is there any evidence on the use of Mucinex on sperm motility? One study I saw was an old preliminary case report. What is your experience?
There are studies that show that you can use Mucinex to improve the thinness of the mucus in the ejaculate. So yes, it is beneficial. Yeah, it does work. Guaifenesin or guanifesin, I can never pronounce it, but that's the active ingredient in it. It does work.
All right, I got some numbers here. You ready?
Numbers. Okay.
Yeah, like, you know.
Do I need a pen?
No, not that many. I think you can do this in your head.
Okay, go.
See, this is one of those things I would shoot off to you. You know, I just put it in that computer software that you guys
That
have
did
here.
not come out sounding
just-
right.
No. That came out 100% right. You're just...
Just go.
All right. So if AMH and AFC have been consistent over the past 2 to 3 years.
AMH, AFC are good. Yeah. Yeah.
AFC averaged 20,
Oh, that's good.
AMH 12.9, 9.2, and 13.4.
Okay.
Any concern it would have dropped suddenly in 6 months? Had a bad round of IVF, not sure if a one-off.
Well, first of all, your AMHs are relatively close to another. The 9.2 was a bit of a drop, but 12.9, 9.2, 13.4, they're kind of in range with one another. The AFC of 20 doesn't actually fit with your AMHs, so I'm a little confused on that one. But admittedly, we do see that from time to time. I had a patient today who had an AFC of 24 and her AMH was 8.1. So they just didn't jive together, and I was trying to explain that to her. Lovely young lady. So sometimes it's hard to figure this out. So I would probably want to see how you did with your stim and then figure it out from there.
Hi, Dr. V. Will you have a clinic in the States?
Will I? Yes. First, let me prevent my executive team from strangling me for opening up the ones I've already started opening. And then when I survive them, I will start focusing on the US. And we're also trying to open up in the UK. So I've been working hard on getting my license there. It is painful, but I think I finally figured out how to do it. So yeah, it's a work in progress.
Is 4BA good quality embryo? My uterine lining is 8.3, started progesterone for FET.
It's a great quality embryo. You're in great shape.
Would you transfer a low-level Mosaic -6Q 35%? If so, would you recommend amino?
Amnio.
Amnio. And I'm sure that's what they wanted, right?
Amnio. Yeah.
How concerned should I be with baby being born affected by the deletion?
Would I transfer? Yes, we transfer low-level mosaics all the time. I have no hesitation to do so. They, in most cases, will end up being normal babies, or they won't work. So if they're abnormal, they probably won't stick, and if they're normal, they will. Would I recommend an amnio? Yes, it's a very reasonable consideration. Obviously, you would start with NIPT, and then you can go on to amnio if you want an amnio. And then as far as the ability to worry about it or how much you should be concerned about it, I wouldn't be concerned about it. I mean, you'll know, but we now have built-in genetic counseling for all our IVF cycles. So all of our patients get genetic counseling. So that's something you would discuss with Andrea from Genomic Care and her team. She's awesome. You know, we have to get Andrea on the show.
She wants to be on the show.
When can we bring her on?
We can figure that out.
We got it. You know, Inception wants to come back on.
Oh, really?
So let's bring them on next week.
Okay.
And then maybe Andrea the week after.
Yeah.
I'll be back from Berlin too. So that'd be good. Yeah.
Okay.
Yeah.
What are the risks of taking GLP-1 medication while pregnant? Did not know of pregnancy.
Contraindicated in pregnancy. We don't know what the risks are because there's no data on it yet. So get off, stay off, be followed very closely. That's all you can do.
What are your thoughts on continuing to diet while on medication for IVF? Have lost some weight. Should I stop reducing calories while stimming?
It depends. If you're like super calorie restricted, yes, that's a bad idea. But if you're like reasonable calorie restricted, no, leave it alone. just stay on what you're on.
Can you talk about recurrent pregnancy loss and transferring only 1 versus 2 for genetically tested normal embryos?
I'm not sure what you want me to talk about with regards to recurrent pregnancy loss. I mean, there's all sorts of different reasons for it. But in terms of 1 or 2, I'm going to sneeze. Oh, excuse me.
Yes, sir.
Thank you. 1 genetically tested euploid embryo in a healthy patient with no major medical issues should yield a very high pregnancy rate if they're using all of today's current science, technology, knowledge, all that stuff. Most places are getting about 50%. Ours is much higher, but I think we have kind of more advanced protocols than most places do. If you're talking about putting in 2, the studies support the concept that you have a 70% chance of ending up with twins. Twins by itself, even if everything else is perfect, is a high-risk pregnancy for the mom, for the babies, and for you socially, because it's a very high divorce rate. So we aggressively try to avoid that. But in some cases, we'll do it, but very rarely. We try hard to convince people not to put in 2 at a time.
Is it okay to take prednisone, Medrol for FET if I have insulin resistance? I am not diabetic, but find these medications increase my blood sugar levels.
They will. So you got to be very careful with your blood sugar for sure. Yeah, that's important.
I was priming with testosterone and it was really high. Great response, and I got the highest number ever of good quality embryos. All 4 were abnormal. I'm 38. What to do next?
Same thing. Statistically speaking, if you try again, you'll get, some normal embryos. There are studies that have shown that if you don't get any normal embryos in a first cycle, I think we reviewed that on the show, that in the subsequent cycle, you should have this normal response. So sooner or later, you should have one that's normal. There's a recent study which showed that in people that were able to generate 10 embryos, every single patient had at least 1 normal. Now, I can tell you factually that's not the case because I've had people make more than 10 embryos and have no normal. But statistically, according to this study, and they had a huge number of embryos, I think it was close to 100,000 embryos in this study. If they had 10, they had at least 1 normal, which is pretty promising.
Hi, T and Dr. V. What is the relative risk for poor birthing outcomes with marginal or velamentous cord and subsexcentriate placenta, no visa previa? Anything to be aware of?
Nah, don't worry about any of those. They're nothing. Vasa previa is huge, but subscentriate, low marginal cord insertion, as long as they monitor the baby's growth, you're fine. Don't worry about it. And that's only for the marginal cord insertion.
Can we try modified natural with your endo protocol after 3 months of Lupron and letrozole?
Yeah, sure. You can try anything you like. That's a reasonable approach.
Hey, Dr. V&T. 3-parter for you. No, it's a 3-parter.
A 3-parter. All right, I need my thing again. Yep, fire.
Okay.
Part 1.
You mentioned ovarian drilling to me. How exactly does that help? What is the success rate compared to IUI? And is it covered by OHIP?
It's covered by OHIP. The success rate compared to IUI, I don't know. I don't know anybody that does ovarian drilling anymore. I never did it, but it's possible. And how does it work? So in women with PCOS, the stroma of the ovary, the structural parts of the ovary, not where the follicles are, but the parts that surround the follicles, are very thick. And so if you dip into the ovary with a needle and electrocute those parts, you burn them, it gets rid of a lot of the stroma, which reduces the LH level and lets the ovary function normally again. Typically, it only lasts 6 months. It's associated with adhesion formation, and you are destroying a lot of eggs. Now, PCOS women can afford to destroy some of the eggs because they have a lot of eggs, but it's not an ideal situation. So we do it only when nothing else works. And honestly, I can't remember the last time I had to.
That's something I would have asked you about.
That's when you would have
asked me. Ovarian drilling. That's the first time I heard that.
That's good. Ovarian drilling? Yeah. You know who used to do a lot of ovarian drilling? My great colleague, Dr. Pattinson. I would actually probably get him to come and tell me what to do.
Wow.
Yeah. because I haven't done it for a
See,
million years.
you ask a doctor.
You ask a doctor.
It's the same thing, man. I'm not really sure what the problem is.
So I'll tell you something interesting that this brings up, okay? And I've talked to patients about this a lot lately. There are so many doctors out there that are either offended or refuse to work with patients that want a second opinion or want assistance or collaboration. Like, if patients say, will you work with my doctor? I'm like, yeah, I'll work with anybody. Like, the more heads in the process, the better.
Sure.
It's not like I don't reach out to people once in a while when I'm confused about something. I do. Of course I do. I have colleagues out there that I trust, 2 of them, and I reach out to them and I ask them. So, there are times where I will reach out for assistance as well. If you're so stubborn and headstrong that you refuse to work with other doctors, I mean, like, there's a problem with that. I don't get that. Why wouldn't you want to optimize the patient's experience? I really don't get that.
Unless they think they're way better than the other doctor.
Yeah, but no matter how good you are, you always have room to improve. Like, I don't look.
Me as a doctor,
Yeah,
for sure.
you as a doctor.
I would always consult.
Yeah, that's
Generally speaking.
that's a good idea.
Yeah, I would always.
I got no hesitation taking opinions, thinking about it, discussing, round table. Like, I'm willing to be fierce in my defense of my own thoughts, but I'll listen. I'll hear people out. I'll give it thought and consideration.
I, as an individual, would greatly appreciate a doctor saying, you know what, someone, you think, you know what, let's hear what he thinks.
Yeah, I think it's a good thing.
Absolutely.
I don't think it's a bad thing. Okay, 3-parter.
Those were the 3 parts.
Oh, those are the 3 parts.
It's 3 parts, simple parts.
Easy. Okay.
Yeah.
Yep.
The drilling part got me confused. The other 2 I could have handled for sure.
There you go.
The
Ovarian
got
drilling.
me.
Yeah. It's only for PCOS women.
Hi, Dr. VNT. Finally made it to transfer today, but my nurse at my clinic was concerned about my estrogen, 42 nanograms per mil being too low. I'm doing your protocol. Please check your DM. It's Anastasia. Thanks.
It's not too low. There is no lower limit to estrogen, so don't worry about it.
Hello, dear Dr. Victory and dear Tarek. Well, that is just a great introduction.
That is a great introduction.
I like that.
I like that too, yeah.
What does hypo mean, and what are the symptoms? Much love from Unit.
So it means that the signal from your hypothalamus or pituitary gland is low, so you're not producing LH and FSH, and as a result of that, you're not producing estrogen and progesterone. So hypo brain signal, hypo ovarian response. There's a Carly Steele question.
Yeah, there's a couple right before, but almost no just
Carly, the answer to your question is yes. I got to take that one. I saw it on the screen. It's always safer to induce at 39 weeks.
Okay, let's go to TikTok for a minute. No problem.
All right.
I'd go see Dr. Oh, we answered that already. Are the statistics 1 live birth per 3 untested embryos of 3 euploid embryos?
What?
Are there any statistics 1 live birth per 3 untested embryos of 3 euploid embryos?
Not sure I understand the question. There is statistics on 3 euploid embryos. It's 95.2%. That's from a study published by Richard Scott's group. And now there's a newer study that says if you transfer 5, it's over 98% that will get pregnant. So that data exists. 3 untested, there's no way to know, right? You could have 0, you could have 100%. It depends on how old you are, what the embryo quality is like. Like, there's a million things that would go into that. So no one's going to be able to predict that.
Soraya's on the show.
Hi, Soraya. Does she have her sheep?
No sheep today.
No sheep today.
No sheep today. No sheep. She's got a lot of hands up.
So she's saying, my doctor said it takes 3 embryos per live birth. That's not true. 95.2% of patients in that study were pregnant after 3 live births. So it means some of the patients got pregnant after 1, and then, like, maybe hypothetically that was 50%. I don't remember the exact numbers. And then another 30% would get pregnant after 2, and then you'd have that extra little bit of 15% that would still get pregnant after the 3rd one. So it doesn't always take 3 embryos. It's just that if you want to get that high success rate overall, you have to estimate that you're going to need 3.
I've been waiting 2 years for a knee MRI. It's next month. If I conceive, do I need to cancel it?
No, you can have a knee MRI as long as there's no metal in you anywhere. So that's fine.
Hi. Any reason for double orgaltran?
Yeah.
Don't think I ovulated early last time. 19 eggs retrieved.
Yeah, I mean, if your LH starts to spike, we will often use double orgalutran to rapidly bring it back down. Like sometimes, patients will start to surge and we need to interfere with their surge. So we'll jump on it and give them a double orgalutran shot. Yep.
Sorry, I ate her sheep, she says.
It was Ramadan. She's probably feeding a lot of people.
She cleaned up house.
Yeah, she cleaned up house. Or the barn.
The barn. She took the barn out. 6 weeks today. Is it safe to see an RMT and chiropractor during the first trimester?
No deep tissue massage, and you're off limits from here to here. So nothing around your pelvis. But otherwise, sure. And no cracking you and snapping you and putting you on those clapper boards and don't do that. That's bad.
Don't do that. I would concur with that opinion, to be honest. Anything that movement like this.
Well, I had my shoulder impingement, so they put you on this board that's got like some sort of weird mechanism, and then they like slam you down, and it like the board's got like a wedge, and then it's like.
No, don't do that.
Don't be doing that when you're
Don't
pregnant.
do that.
No.
Just gentle.
No getting smacked around when you're pregnant, please.
Just gentle stuff.
Gentle stuff. Yeah.
Recent completed baseline testing. TSH was at 3. 2 weeks prior, it was at 1.57. Is this concerning?
It's not concerning, but you want to keep an eye on it and probably adjust it.
What are the success rates at your clinic?
It depends on what you're asking about, but our success rate with one genetically normal embryo is over 80%.
Dr. V, this is for you. Can placenta abruption be detected by ultrasound?
We asked that.
We
one.
did that, yeah.
Yeah.
Is it okay to exercise after embryo transfer? My doctor says absolutely nothing other than walking for 12 weeks. That sounds like torture. Help.
Light exercise is fine.
You want me to get that one? Okay.
Yeah, do you want to do that one? Light exercise is fine. Don't do anything more than light exercise. You would have said the same thing.
Yeah. See, it's not a horrible system.
It's not a horrible system. You know what? Maybe I could use you here, buddy. Yeah.
How accurate is a positive multiple marker screening comparing to NIPT? Should one worry after getting positive on the multiple marker? What are other reasons the test shows positive?
Okay. So, you got to understand what you're finding and what positive means. The multiple marker test or early first trimester screen is a screening test. Okay. It is not telling you if you have a baby that is affected or not affected. It is telling you you are in a group of people that are considered higher than normal risk. And the normal is completely arbitrary. Okay. They just chose a number. And if you're in that group, then you merit getting additional testing, which then tells you yes or no, which is the NIPT. So let me be very specific about this. When you do an EFTS or the multiple marker screen, you're getting a score that says your risk of the baby having Downs or the cousins of Downs is 1 in blank. So when you get a positive, it's because your score was higher than 1 in 385. So let's say your score was 1 in 200, okay? So you are going to screen positive. Your baby has a 0.5% chance of having Down syndrome. And it is very accurate for that chance. It means if they took 200 women and they all had the exact same numbers that you did, one of those women has a baby with Downs. You all screened positive, but only one of you actually has a baby with Downs. That's what that means, okay? When you do the NIPT test, you're actually pulling fetal DNA out of mom's blood, and so that has a 0.0001% error rate. It's very, very accurate. And that's a yes/no. There still can be errors, but it's typically very, very accurate. So if you're looking at problems with the EFTS and you're wondering how accurate it is, it's not accurate in the sense of positive negative. It's accurate for what it's detecting. Yes, you do have a 0.5% chance if you're 1 in 200, but that doesn't tell you if it's you or not. It just tells you you have a 0.5% chance. So people get confused about that all the time, and we have to explain that to people all the time. I don't ever worry about the early first trimester screen unless it's really high, like over 1 in 10. Less than that, you almost never see that the results come back positive. Because think about it. Even if you come back at 1 in 25, you got a 4% chance that the baby has Downs. Like, it's super low. There's a 96% chance your baby is fine. So you really have to have a very high level in order to find that the baby has a problem.
Hi, Dr. V&T. I'm experiencing spotting 4 days prior to day 1. Should I get this checked out before my next FET? Not sure if this is a matter of concern.
Yeah. Make sure you don't have a polyp, a fibroid, cervical dysplasia, abnormal bleeding, excessive estrogen, excessive weight, bleeding disorder, whatever the case is.
Hi, T and Dr. V.
Oh, see? They got the order right that time.
They got the order right.
That's nice.
That's right.
Yeah.
Not bad.
Yeah.
If AI genetic testing is available, and I understand it's not as accurate as PGTA testing, in what situation would you suggest using AI testing over PGTA testing?
We have it. We've been using it for a while. We like it. It's reasonably accurate. If you have 2 embryos in the highest category, there's a 97% chance that one of the 2 is normal. So that's kind of helpful. But realistically, it's not at all like PGT. Like PGT, you know if your embryo is normal or not. This is giving you a percentage chance, just like I just mentioned for the early first trimester screen, that your embryos are normal or not. And it's broken down into 4 categories. There's low chance of being normal, which is a 38% chance. Then there's like medium, which is I think a 55% chance. And then there's high, which they consider a 65% chance. And then there's very high, which is like a 76 or 77% chance. So even when you're in that very high group, it doesn't mean your embryo is necessarily normal. When do we use it? We use it when people can't afford the full PGT because the AI is way cheaper. And we use it in people that didn't do the PGT and then regret it and want to do it later instead of having to thaw the embryos. We just use the AI. So those are the 2 places where we think it's useful.
Hi, team. Does NAC reduce testosterone level with DOR?
Does NAC reduce testosterone level with DOR? Great question. No idea. Don't know. I wouldn't think so. And I can't understand a mechanism by which it would. But I would have to look that one up. And I can't because Tark hijacked my computer to put TikTok on it.
It's important.
It's important. I get to see the questions that way.
Oh, look at this. Listen to this.
Yeah.
Hi, docs.
Hi, dogs.
Plural. I take that.
There you go.
Is there such a thing?
You're going to have to get used to it for your new clinic.
That's actually true. That's actually quite true. I should get used to it, to be honest. Wait till I go home. Whole new level. Is there such a thing as taking too much omega-3 when in the first trimester? My prenatal has 200 milligrams DHEA, 60 milligrams of EPA, and I'm taking an extra with 500 milligrams EPA and 250 milligrams of DHA. Is this okay?
I don't know what the upper limit of okay is for that, but you probably have to take a ton. The one problem with taking too much DHA is that it can actually thin your blood. So check with your pharmacist before you take too much. In general, can you take too much of anything? Yes, you can always take too much. You can take too much vitamin C. 18 grams of vitamin C is the toxic level. Now, you're crazy if you're taking that much, but that's the toxicity level.
Why are older women having kids called geriatric pregnancy?
I hate that. There's no such thing as geriatric pregnancy. You're not geriatric until you're 65. So I hate it when people call it geriatric pregnancy. There are no 65-year-old women having pregnancies, so no.
If you want to get pregnant, go do it.
Go do it. There you go.
There's no age for these things.
Well, 65. You're going to be,
Yeah, but geriatric is a big term.
I know, but a 65-year-old, the kid's going to be 13 when you're dead, on average. That's not,
65-year-old.
that's
If
not
you
good.
go to any Middle Eastern person, 65-year-old, the guy's like, yeah, I want to die already. 65-year-old Middle Eastern guy. That's it. I'm all done.
It's all done.
It's all done.
Yeah. I'm just going to be starting my life when I'm 65.
Yeah.
Jenna's going to be taking over at that point. Carly, is my question popping up or is T being rude?
I don't understand what I'm supposed to.
I don't know. What was your question, Car?
We probably answered it. I think we answered it.
I don't know.
Is it always safer to induce at 30 and
I
30 weeks
answered
than
that.
not?
I
They
answered.
blame me.
I
Dr.
answered-
T doesn't miss questions.
Car, I answered that one earlier in the show. Yeah,
He actually skipped a bunch of questions to go right to it.
I did.
Yeah.
I did.
Okay.
Oh, she says she
that's
asked another one. I don't know what your other one was.
my question-
It didn't show up.
I don't think it showed up.
I don't think it showed up either.
Just so everyone knows, again, because this is very important for everyone to understand. There are a bunch of questions,
And we try and get them all.
and we try and get them
Yeah.
all. We try.
Yeah.
We really try
We
our
cannot
best.
answer everybody's
This
questions.
is also important for me as an individual because this is how I gain my knowledge when I see my patients.
There you go. This is
Yeah. Okay. My ANA is 1 to 80.
yeah,
My autoimmune screening looks normal.
yeah.
But I have a high cytokines and low LADs. Is ANA elevated for high cytokines? I will be doing tacro and cytokines. Will this help for ANA too?
No, ANA you need aspirin and heparin.
There you go. I would have forwarded you that question. I have a bicornuate uterus.
Okay.
My last pregnancy ended in miscarriage.
Oh, I'm sorry.
And doc says it's because it was in the middle of the uterus.
Sure.
Is there anything I can do on my part to help it implant better?
No. Well, I mean, don't smoke, don't drink, don't use drugs, make sure your weight's appropriate, make sure your diet's appropriate, but no. Take lots of vitamins. Just the basics.
What is your protocol for PCOS? What would you recommend to help with ovulation and implantation?
Say that again. Read that one more time.
What is your protocol for PCOS? What would you recommend to help with ovulation and implantation?
Well, it depends on what protocol you're talking about. Natural, like FET, IUI, it depends. Letrozole is the start, injections carefully if you're trying IUI or a mix of injections and letrozole. And then for IVF, like a normal stim, but not high dose because you don't want to make the patient make too many eggs.
Sorry, I was wondering if you were able to find a man for her.
I have not been able to find a man for you, sir. I'm sorry.
How soon after giving birth can you start your next embryo transfer?
Ideally, no earlier than 6 months. Okay, this question came up twice. Can I ask this
Yeah, go
one?
ahead.
Can you miscarry because of gender? Yes. There is this one specific thing where there's an antibody to the XY chromosome set. And so some women have difficulty carrying boys. It's rare, but it's possible.
I have a polyp near the lower part of my cervix.
Okay,
My doctor advised me to remove it.
sure.
Will removing it increase the chance of pregnancy considering it's near the lower part of the cervix?
Probably.
Not at top.
Probably not, but I guess it's possible if the cervix is causing inflammation, which is interfering with the sperm transport, but probably not if it's a small polyp near the bottom of the cervix.
Sorry, I was going back to her sheep because you don't have a man for
I
her.
don't.
She's done.
Someone just said, should I include alien abductions in my medical history? Yes, because that would be definitely
very
new.
important
I've
information.
seen almost everything, but I've never had someone that told me they were abducted by aliens. How many of you have been abducted by
Yeah,
aliens?
great
I would
question.
love to see how many have been abducted by aliens.
Can someone be a biological father if he has maturation arrest azoospermia? Johnson score 6 out of 10. Any possibility or hope? Thanks.
Not It depends on how late your sperm make it before they arrest. Maturation rest can occur at different stages. If you have an elongated spermatid, it's still possible. Earlier than that, the success rates are miserable.
How accurate is a positive marker, multiple marker screening?
We did that one.
Okay. Hi, Dr. VNT. I got 8 blasts on day 4. On day 4, we're on stage 2, and 3 on stage 3. Again?
What?
I got 8 blasts on day.
Okay.
4 were on stage 2, and 3 on stage 3. The lab was able to biopsy and freeze them on day 6.
Okay.
Are they day 5 or day 6 blasts, and how good are day 6 blasts?
If they froze them on day 6, they're day 6 blasts. And how good are they? They're great. Day 6 blasts are fine. I don't know what you mean by stage 2 and 3. We don't have stages for blastocysts.
Thoughts on using a trigger shot for transfer?
Someone from Morocco is saying, is there a single man here by any chance? Your favorite Moroccan is here. Our show has become like Tinder. That's awesome. I never expected that. That's great. You know what? There's all these women out there. They need a guy.
Absolutely.
It's a great place to fish for a nice lady.
That's it.
We should we need to make some money off of that. So
this is an opportunity.
What would we call it? Oh yeah, you gotta slide that dumb arrow thing across. And
TikTok has a hard time believing that we're having such a good time. They don't want to believe it.
So what would we call it?
Well, it's still somehow related to fertility.
I don't know. Fertility Finder instead of Tinder.
Fertility Finder. There you go.
Fertility Finder, except that actually it would be spelled like Finder, so it kind of works both ways, right? We would just pronounce it Finder.
Carly, your question did not pop up.
No,
it did not.
Yeah, Carly.
We're sorry.
Well, she can't text me either. I won't see it.
When doing fertility immune testing,
Yeah.
are there tests that are not applicable if using anonymous donor sperm?
Carly's. Are there when using who, what, where?
There you go. When doing fertility immune testing, are there tests that are not applicable if using anonymous donor sperm?
DQ alpha and KIR.
What are some ways to bring down C
reactive protein?
Yeah. Will high C reactive protein compromise transfer of genetically normal embryos?
Yes, it would. It's an inflammatory marker. How do you bring it down? Reduce inflammation, acupuncture, healthy diet, exercise, avoid crappy foods, take lots of vitamins, antioxidants, that kind of thing. She says she asked on IG and that she's freaking out. Do you see a Carly question before she quote unquote freaks out?
Any evidence on perineal massages and when should I start?
Is that her question?
Yeah, well, I don't know why that wouldn't show up.
I don't either. Maybe
Call it Love Doctors V and T. Oh yeah.
Love Doctors. Carly, there is some evidence actually that perineal massage is beneficial. Yes. I find it creepy, but and I'm reluctant to say it, but there is actually evidence that it's beneficial. Yeah. And
we should end it on that one.
We can end it on that one. Oh yeah, it's 5 past.
Yeah.
All right. Any last question?
Comment, you never need a guy.
She says my ex-husband is excited to do that.
Yeah.
This is a PG show, Carly. Come on.
Sometimes it's a little bit risque.
It's a little bit risque.
Sometimes a little bit risque.
Yeah. We're going to get ourselves in trouble on all these channels.
We are simply giving out information.
That's right.
That's all.
Right. Yeah.
That's it. This is not medical advice.
No.
No.
Just information.
That's why I can do it.
All right. One last question.
Yeah, there's like 1 billion on Instagram, unfortunately.
Is there?
Yeah, Instagram's yeah. And also on
come listen, if you didn't get your questions answered, please come to the Canadian Fertility Show. Apparently, I didn't know this. If you use my name when you buy your ticket, you get 50% off. Come to the Canadian Fertility Show. We'll be there for an hour. I have a breakout session. Rather than doing another talk that would bore everyone to sleep, I'm just answering questions. So it's like live fertility fact or fiction, like in person.
Without me.
You could come. You want to come to TO? You could be there. Everybody get a chance to meet you.
A live fact or fiction.
Without you.
Without me.
Yeah.
Yeah. That's great. Okay. You wanted another question or?
One last question.
Okay.
I don't care from where.
Let me get one here for you. Hi, Dr. Victory. Thank you for doing these. I totally forgot to ask today. Would you also transfer high-level mosaics?
High-level mosaics have between a 20 to 30% chance that they can become a pregnancy. That's a normal baby. So would I? Yes. Should we? Different question, and you need genetic counseling, but would I? Yes.
Carly's husband's super excited from the looks of it.
Yeah.
and Soraya's insisting that you find
That we find it.
Yeah.
Is that Soraya? Oh yeah.
Yeah.
Makeup by Sor.
Yeah. She's no more.
I wonder if that's her eye. That's a beautiful eye.
Now
I mean, I'm seeing it like this.
Now she's really gonna.
I know, that's a very pretty eye. All right, listen, guys, it is time for us to shut this down before it gets too out of hand.
Before they shut us down.
Before they shut us down, yeah. You all have a very lovely evening. Thank you for staying up to watch. One of my very dear German patients asked me a question earlier as well. I did answer you, but just in case you didn't hear me, because I know you stayed up to watch the show, and I love you for that.
Fertility after dark.
Fertility after dark. Oh, that's a good one. So LIT takes 2 months. So we do one treatment, and then you wait a month, and then we do another treatment, and then you wait a month. So you would need to be here twice. So that was the answer to that question. Anyways, I hope you guys have a lovely evening. God bless you all, and we will see you again next week, where we will probably be talking about cord blood banking with our friends from Inception Cord Blood Bank. And I think they're giving away a free cord blood kit. So join us and watch. I like Fertility After Dark.
It's really good.
That's cute.
Fertility After Dark's nice.
Yeah. We'd probably have to put it on a completely different channel.
Yeah.
Not one of these ones.
No.
We'd have to open up our own OnlyFans channel. I wonder if we could do like a crude version of this show.
I could definitely do a crude version of this show. I could definitely do it.
That would be...
I feel like I'm censored 90% of the time sometimes.
That would be kind of crazy. Yeah. Can't wait to meet you Sunday. I thought it was Saturday. Is it Saturday or Sunday? I have no idea what my schedule is, people. Love you all. See you whenever I'm seeing you. I hope you all have a wonderful evening. God bless, and we'll see you soon.